How are male fertility tests performed? Have you ever wondered how male fertility tests are conducted? Understanding this process can provide valuable insights into male factor infertility, which is a significant aspect of couple infertility. The journey typically begins with a semen analysis, a non-invasive laboratory test that evaluates sperm quantity and quality. To collect a semen sample, men are usually asked to masturbate into a sterile container. It is recommended to abstain from ejaculation for 2 to 5 days before the test to ensure accurate results. If the sample is collected at home, it should be kept at body temperature and delivered to the lab within 30 minutes to 2 hours for the best analysis. During the semen analysis, several key factors are assessed. First, sperm concentration, or count, is measured to determine the total number of sperm present in the semen. Next, sperm motility is evaluated, which looks at the percentage of sperm that are moving and how well they move. Sperm morphology is also examined to assess the shape and structure of the sperm, using strict criteria to differentiate between normal and abnormal forms. The analysis also measures semen volume, which is the total amount of fluid ejaculated. The consistency and liquefaction of the semen are important too, as they affect sperm mobility. Other chemical properties, such as pH and viscosity, are analyzed since they can influence sperm function. Additionally, a white blood cell count is performed. Elevated levels may indicate an infection or inflammation, such as prostatitis. Depending on the initial results or clinical suspicion, additional specialized tests may be conducted. A sperm viability stain can determine the percentage of live versus dead sperm. Sperm DNA fragmentation tests assess the integrity of sperm DNA, although these are not standard and may only be recommended in specific cases. Hormone evaluations through blood tests measure levels of hormones like testosterone, follicle-stimulating hormone, and luteinizing hormone, which are crucial for sperm production. Anti-sperm antibody testing may be performed to detect immune factors that could impair sperm function. In some cases, a postcoital test is conducted to examine how sperm interact with cervical mucus, which can be particularly relevant if female factors like endometriosis affect fertility. A physical examination by a urologist is also an essential part of the evaluation. This includes reviewing medical history, lifestyle factors, and any history of infections or surgeries that might impact fertility. From the perspective of fertility and endometriosis, male fertility testing is vital. While endometriosis primarily affects female reproductive organs, male factors also play a significant role in couple infertility. Accurate assessment of male fertility status helps guide appropriate treatment plans for couples facing infertility. In summary, male fertility tests involve a combination of semen analysis, specialized sperm function tests, hormone evaluations, and clinical assessments. These tests provide detailed information about sperm health and identify potential causes of male infertility, enabling targeted interventions where possible. Always remember, if you have concerns about fertility, consulting a healthcare professional is the best course of action.